My name is Dr. Parijat, and I'm one of the lead diabetes consultants in London Diabetes Centre, Birmingham. Today, we're going to discuss a few basic topics around diabetes. So, diabetes is a metabolic disorder which is characterized by high blood sugars over a period of time. And broadly speaking, there are two types of diabetes, type 1 and type 2. Now, diabetes develops either due to deficiency of insulin, which is type 1 diabetes, or the body not responding properly to the insulin produced, which is commonly known as type 2 diabetes. Of course, there is gestational diabetes, which is diabetes during pregnancy. Type 2 diabetes accounts for nearly 90% of diabetes we come across, and generally speaking, 90% of type 2 diabetes patients, by definition, are either overweight or have obesity. Untreated diabetes can lead to a number of serious complications like heart disease, stroke, kidney problems, problems with feet, eyes, and of course, psychological issues. There is a very simple blood test we can do to confirm diabetes, and it is called HbA1c. And people who have symptoms of excessive thirst, passing lots of urine, or losing weight, if their HbA1c blood test is over 48, by definition, they have diabetes. Of course, a lot of people these days are being diagnosed with what we call pre-diabetes, with an HbA1c between 42 and 47. And this is the group we need to be particularly careful about, as they can not only progress to frank type 2 diabetes, but also develop complications long term. The key principles to management of this chronic condition is diet and weight loss. Diet is simple, but again, very difficult to comply with because it's a long-term condition. What we really want to avoid or reduce is the carbohydrate portion size. And of course, exercise at least 30 minutes a day, 5 days a week is going to help long term. Not to gain weight is perhaps the cornerstone that one needs to remember in managing not only people with pre-diabetes, but also diabetes. Because if one loses weight through diet or exercise or a combination of a number of lifestyle factors, it will prevent them from developing frank diabetes from pre-diabetes. And of course, long term, this will help prevent a lot of complications. And the good thing nowadays, with research, we know that we can even reverse diabetes early on in the course of the disease. So losing weight is perhaps the most important step in the management of this long-term chronic condition. So how do we manage diabetes? Modern day management of diabetes is not just treating blood sugar, but there's much more to this disease process. Through the London Diabetes Centre, Birmingham, one will have access to a wide range of specialist services and modern and upcoming treatments, both for type 1 and type 2 diabetes. In particular, latest treatments called SGLT2 inhibitors, or commonly the gliflozins, or The once weekly GLP-1 injections not only help control the blood sugars, but have tremendous influence on weight loss. And these are treatments we use very early on these days. The added benefit of the gliflozins and the once weekly injections is that they protect the heart and the kidneys as well. Through London Diabetes Centre, Birmingham, one will also have access to specialist physicians and nurses and other healthcare professionals who can discuss the latest technologies like Freestyle Libre for both type 1 and type 2 diabetes and the continuous glucose monitoring facilities available. So how is London Diabetes Centre, Birmingham different? Yes, we are different. We do things differently. We have professionals who can spend time with patients and tailor investigations and treatment to the personal needs of a patient through listening and arranging thorough testing so that the best treatment is on offer at a time and place suited for the individual. If you would like to know a little bit more about the London Diabetes Centre, Birmingham, please do get in touch with us. You can see our facilities and the various treatments that are on offer, either by directly contacting us or visiting our website. And we'll be more than happy to discuss the arrangements we have to suit the individual patient. Thank you.